Hello, hello. Welcome to this episode of the Hello, Hello podcast. I am your host, Alyssa Rogers. And check out where we are today. We are at the Sentara Mobile Care Clinic. I mean, have you passed this? Have you seen it around town and wondered, what are they doing in there? Well, we're going to find out today because we have Kim Murray here. Thank you for having us.
Thank you for having me.
Yes, and I just, this mobile clinic has shown up around the community and people have questions about what they can come in for, what it is, and so thank you for having us. And we'll just start by, what is the Sentara Mobile Care Clinic?
So actually, I've come across quite a few people that have asked, like, what do y'all do there? Well, we are a clinic on wheels, and we are created through Sentara Community Care to provide care to people that have less than average access to health care. We try to target areas that are lower income to meet the needs of people that may have, for any reason, have hindrances to health care, if it's transportation or don't have health plans or insurance available. We do have a community health worker, Deja Womack. She actually can help you sign up for Sentara health plans. We try very hard to meet those needs, meanwhile trying to serve those people and take care of their health needs while we're waiting to get their health coverage in. We see people that do have insurance as well, so if you need primary care or you need someone to fill in the interim, we can provide primary care, we can provide sick visits, we do women's health visits as well. We can check your urine, draw your blood, we can run COVID tests, flu tests, strep tests, we can send you to the hospital to get x-rays if needed, that type of thing. We have quite a few people already on board in the community, but we really try to take the time to meet your needs. If you need help with resources, again, our community health worker is wonderful at meeting those needs. I'm the nurse practitioner, the provider for the patients. I do like the fact that we do have a little extra time to educate people and explain to them why they need to follow our recommendations, to help them understand what happens if you don't do this, and why you need to follow our recommendations. And I really enjoy that. I do have a missions heart and have been on many missions trips, and I just love that our community, while we may have a lower income community, we can try to reach out and cover them and meet those needs that they have. We also provide services to the community. If you have any civic groups that need speakers, I can come out and speak to them, or our staff can as well. We also like to go to health fairs. We can do sometimes cholesterol checks, blood pressure checks, that type of thing, glucose checks at times. To be able to just do some basic screenings for the community in different civic groups.
I think this is so fantastic that you are meeting people where they are. You're going to them. So what does it look like when you set up? Today we are in the Church of God parking lot in Halifax County. And so you set up here. What does it look like? Do they have to call and make an appointment? Do they just show up? How does it work?
Well, we do have a set schedule. So we always invite people, if they have time and they need to be seen, to stop by. If we have an opening, we'll take them right away. They'll come in to see the nurse. If the nurse sees that they have some community health needs, the community health worker will also talk to them and get the information if they need paperwork completed and help them through that. The nurse will go ahead and triage them, get their vital signs and their basic health information. We can send for other health records, and then they'll come back to one of our two clinic rooms, and I'll interview them and give them a good head-to-toe physical depending on what their needs are, and we'll go from there.
That is awesome. And I mean, guys, like, we are in a bus right now, and I feel like I'm at an actual doctor's office, and you're set up with everything. So take us through, like, what is in here? What can be done in here?
Well, we have a small table here. We
Yep.
have the scale here.
Yep.
We have some equipment, the same equipment up front. This is the otoscope and ophthalmoscope to look into eyes, to look in your ears, and of course the pieces that go with that, thermometer, your blood pressure equipment. There's also an extra seat if we're seeing
Yeah.
children, because we do a lot of sports physicals, school health physicals for children, that type of thing. This is what used to be called a Sally. It has a new name now, but this is where we can log in online and get an interpreter for those that are that speak different languages, and we'll have an interpreter on the video to translate for the visits as well. And parents can sit here, or friend or family who's with the patient. This is my little desk area, but also sink area. We have some cabinets above and below, our glove box, of course, and this is just where we keep different equipment for procedures. We can do minor procedures if needed. We can do women's pelvic exams, that type of thing, swabs, and trying to think of some of the simple things that we've done. Simple abscesses, that type of thing. I'm also part-time ER provider, so I do have experience doing those. But if they're more detailed, in-depth, they're better suited at the hospital, we'll make that recommendation as needed. We also have right here beside the camera a whole lab room with our lab equipment that runs our tests. And those have to go through a series of checks every day. Our nurse is wonderful about taking care of those to make sure everything's in good working order.
Yeah.
We also have refrigerators here where we keep vaccines, because we do provide vaccines for, again, the children.
Yeah.
We also have the adult vaccines as well if adults need their pneumonia or shingles vaccines. We also provide vaccine events. We just did one yesterday at Dan River Middle and High School. We have actually been to quite a few of the Pittsylvania County schools, and are hoping to expand on that and meet the needs of other school systems as well, where children kind of fall through the cracks, can't get in to see their primary, can't get their vaccines updated for the Virginia requirements, and we'll provide those as a service to the community.
That's awesome. And so today, like I said, we're in the Church of God parking lot, but you go to a lot of other places, including Pittsylvania County. So how can people find out where you're going to be?
Okay. You can always call our mobile unit, which is 434-517-8925, and ask us where we're going to be at any given location. You can also go online at the Sentara Halifax Community Hospital website, and Wendy Cruz is really great about it. Either the end of the previous week or the beginning of this week, she'll post where we're going to be for the week. And we're open Monday through Thursday. We do at least 2 days a month at Hitachi, so that the employees there can access health care without actually having to leave work. And we would like to expand on that for other
Businesses.
local businesses. Thank you.
Yeah, you're welcome.
Local businesses as well. We do go to Union Street Missionary Baptist Church in Danville, which is right beside a lot of lower income housing, to meet those needs there in that community. We also park on every other Thursday, just depending if there's no special needs. Every other Thursday we park near Sinai at the right kind of across the stoplight from the Quick Shop there, to meet those needs for that community. We have had some locations in the past in Chase City as well, and we're working toward expanding there also.
That is fantastic. I just think this is an awesome thing that is available to our community, everyone in the community. And you've been in healthcare a long time. This is your passion.
Yes.
This is your love. What does this venture mean to you to be able to do this?
My heart is in missions, and I have been in healthcare for 35 years. Ever since I can remember, when I was a little girl, I always wanted to be a nurse. And as I went through different areas of nursing, and especially during the school system. I really just love serving other people and helping them with healthcare needs. That kind of prompted me to go back to school to get my nurse practitioner, to be able to provide, primary care and a more focused, need that's in the community, because we are in one of the areas that need more primary care, and people are waiting a long time for visits.
Yeah.
That's another need that we try to meet. If patients come through the ER, the provider's there. If they cannot get them in and they don't have a primary, they'll utilize us to be able to get them a quick visit if they need a quick follow-up. We like to be available as much as we can to our community to work people in that can't get in to see their primary, or to utilize us as a primary if that's what the need is.
And really, healthcare has changed so much over the years, and so many people say that it's missing that personal touch. And I just feel like this is bringing that personal touch back to healthcare, where you walk in, you feel comfortable from the second you walk in. I walked in for the first time ever today, and it's such a welcoming, comfortable environment. And you feel like you have people like you that genuinely care and want to take care of whoever it is, no matter where they come from, what their background is, anything, they're going to be taken care of.
That's right. And that's where our heart is, and that's what Sentara Community Care is about. We want to meet the needs of our communities and be here for you. And if we don't have what you need, we try to utilize our resources to provide for those needs, such as psychiatric care. We can actually, any kind of specialty really, we have the ability to utilize either a system of referrals where we can send you to those locations, but we also have some means to provide telehealth visits. And if you don't have the opportunity to utilize equipment that you might have at home, if you don't have that equipment, you're welcome to come here, and we can set you up with our computers, and you can do your telehealth visit with your specialist here.
Wow, that's a fantastic resource. I mean, know that if you know of anyone that's looking for any healthcare needs, or just needs to see someone and doesn't feel comfortable, there are a lot of people that don't feel comfortable walking into an office and that very structured environment. Like, they can come here and feel that comfort and get the resources they need. That's fantastic.
Yep.
And what you're doing is really phenomenal.
Thank you.
Sentara gives back to the community in so many ways, and this is just one example of that. And going around and meeting people where they are and providing them the resources. I have linked all of the information you provided above, so call, schedule your appointment, come see them. They will fit you in, they will take care of you, and they are coming to you. So when you see this bus and you wonder what can be done in here, pretty much everything. And if not, they will send you to where you need to go and get you those resources. Thank you for what you're doing.
Thank you so much for taking the time to let everyone know what we're about.
Yes, absolutely. And thank you everyone for watching and listening today. Truly take advantage of the resources that we have right here in our community. Keep an eye out for the mobile care unit. Refer your friends, your family. If you need anything, they are here to help you. And I just appreciate you tuning in, and we'll continue bringing you this great content every week. Continue rating, reviewing, subscribing, and we will talk to you next week.
Thank you.
Bye.